everyone, and welcome back to our next episode of Be Well with Dr. Stockwell. I'm Dianna Klein, your podcast host, and I have the privilege of sharing with you the experiences of Dr. Dianna Bitner today. Dr. Bitner is an OBGYN and minimally invasive surgeon specializing in women's health for over 25 years. She is a certified menopause practitioner, and that is what we will be talking with her about today, is that crucial phase in all women's lives of menopause. Thanks for joining us.
All right. Well, thank you. I am just so pleased that you're promoting women's health and doing more to educate women in what they can do to age well. So I so appreciate you doing what you do. And I love what I do. I'm an OBGYN, have been in practice for over 25 years and have started to morph my career into addressing the needs of women over childbearing age, and have had many aha moments around this. So I'm just feel so lucky to be able to do this. I, loved what I did as an OBGYN, but am loving this next phase. I born and raised in West Michigan. I did my training in Grand Rapids, Michigan, and practiced in Grand Rapids, Michigan, for all this time. And our first clinic is located in Grand Rapids.
Awesome. Awesome. So just a little bit more about that clinic. I know you mentioned that you did start out your career as an OBGYN and then moved on to minimally invasive surgery. And now, in the latter stages of your career, you're specializing specifically in menopause and helping women through that transition. Providing accurate information, providing excellent resources, and providing that really great wisdom and counsel through your company, True Women's Health. Can you tell us a little bit more about what prompted you to start True Women's Health and where you see the company, where the company is now, and where you see it going?
Sure. And it's just so much fun to talk about. So, my first aha moment came about maybe even 10 years ago. So, I'd been practicing for 15 years, and women started asking me questions I couldn't answer. And I joke that us physicians are like men. We like to, sorry, men, we like to fix stuff. And when people come to us and ask us questions that we can't answer, we feel inadequate. And so I didn't like it that women would come to me and say, why am I gaining weight? Why am I having hot flashes? Why don't I want to have sex? Why my life is great? Why do I have all this anxiety? What's happening to me? And I couldn't answer their questions, and I just hated it. So I'd kind of sit on it a little bit and get back to them with, I'm not really sure. And I saw a flyer about a meeting on midlife and menopause, and I thought, I really need to address this because I want to take care of my patients as we age together. And then, so I went to my first conference on women's health and went, oh my goodness, like there's so much known about midlife, menopause. And I feel called to bring this message, this information back to my patients in West Michigan. And that's what got it started. And, menopause is such a big deal in terms of affecting the quality of our life, but it's also such a big deal in that menopause is the most dramatic risk factor for heart disease, for diabetes, for obesity, for depression, for sexual dysfunction. It is such a big factor in all of that. So if we can pull women in and give accurate, good, healthy information and give women options, then really I'm fulfilling my mission of promoting women's health. And that's what we do at True.
That's awesome. That's awesome. So you guys at True Women's Health, you guys are a brick and mortar, or are you guys web based, online or app based?
So we're opening May 4, and hopefully we'll still be able to stay on timeline. But we're opening May 4, and we're having a specialized practice in women's health, focusing on midlife and menopause, but not just on treatment of menopause, which we will do, but also looking at whole wellness. We think about it like providing all around care for women in this brick and mortar clinic that addresses wellness before menopause, during the menopause transition, and then afterwards in terms of how can we optimize our health. It just makes me absolutely crazy that 80% of chronic illness in women is preventable. 80% is preventable. So that means how many cases of heart disease didn't have to happen. And I'll never forget one of my aha moments with patients is I was on call as an OB in the hospital, and I was called to see a woman on the cardiac floor, right? So I'm an OBGYN going to the cardiac floor. It's not a normal thing. And I got called to see her because she was having postmenopausal bleeding. So I walk in the room and she turned her head to the wall and she's like, "Not another doctor." And I said, "Please, I was asked to see you. How can I help? What's going on?" And she said, "I've been healthy my whole life, and in the last 5 days, everything has just fallen apart." And what had happened to her is she had fallen at home and broken a hip. She was maybe 75, at the time, and she broke a hip. So she came into the hospital, broken hip, went into surgery. During surgery, she had a heart attack. So they fixed her hip. They were able to do that. And then after she had cardiac, stress testing, and she ended up having a stent. And so she had to stay in the hospital to be evaluated for her, recovery from her heart attack and her stent placement. And then what happened is she started having bleeding, and in the course of me then taking care of her, I diagnosed her with uterine cancer. So here she was for so many years with these silent conditions, osteoporosis, heart disease, and she had menopause-related weight gain that increased her risk of uterine cancer. So all three of these things were silent for years, and they were all preventable.
Oh,
And
that's
I was able to, I know. And so thankfully she did well. She, again, thank goodness, came to the right place in Grand Rapids. And so she had great treatment for her heart. She had good treatment for her osteoporosis after her hip fracture. And then after her uterine cancer, she had a surgery with the cancer doctors and was cured. Thankfully, we caught it early. And she said to me, "Is it too late?" And I said, "No, it's not too late." But other than just being more active and taking care of yourself instead of just focusing on your 10 children and 50 grandchildren, can you take care of yourself, but also can you spread the message to your daughters and to your grandchildren in that it's so important to focus on our health through that midlife transition and not just to focus on everybody else,
right. Absolutely. Yeah, we as
right?
especially as mothers and women, we tend to put everybody else first and we don't prioritize our own self-care. And that's such an
Exactly.
issue. Such an issue.
And here she was, a woman, with insurance, with the means to go to the doctor, with the means to understand what she could do to promote her own health. And she just kind of never thought about it. She suffered through, she had a menopause that wasn't the easiest. And she gained a lot of weight. She had some mood issues. She had bladder leaking and urgency, all these things that we have answers of why they're happening and what to do about them. And again, here she was. She suffered in silence. She didn't want to talk about it, and then she ended up having three preventable conditions that likely will shorten her life. So that's why I do what I do, and that's why I was able to give up delivering babies. I was able to give up doing major surgeries, which I loved and I was good at, and had lots of short-term reward, right, and long-term reward.
Sure.
But that's
Absolutely.
why I want to do this, is because if I can make a difference for the patients that I see at True, for people that I don't even get to see or don't even get to know, then I'll be so happy to leave that legacy.
Yes. Oh, absolutely. Absolutely. So you mentioned in your story about this poor lady that she had there was basically numerous red flags. And I think a lot of lay people such as myself who don't have a medical background, we really don't know as we know as women that we change. We know that
Yeah.
overall statement is true. But can you explain a little bit to me and to our listeners about what happens in a woman's body that causes that change? Like why? What is the why behind all of this? And what are some of the initial
Sure.
triggers that we can look at? I'm 38, so I not quite yet. I turned 38 in April, so I've got a little bit more time at age 37. But even someone such as myself, approaching 40, still have hopefully some years left before menopause. But what can I start looking for as far as indicators of issues starting to happen that I need to address now?
Well, exactly. And at 38, it's so crucial that now you really start to think about these things and lay a really good foundation, because after 40, it's time to really get your act together. And then at 50, it's a daily commitment, is how I think about it. But how I want you to think about our system is that we've got the uterus, and that lining is. I want you to think about your lawn, like your lawn. The ovaries, as they every month go through baby eggs, the little cells around baby eggs are their follicles. Those cells around those follicles make estrogen. which I want you to think about like fertilizer for the lawn, and progesterone, which is like weed killer. And estrogen from the ovaries goes to almost every cell in the body, in the brain, in the skin, skin on your arm, skin on your face, skin in your vagina. It goes to our bones. It goes to our blood vessel linings. It goes to breast cells, of course, and it stimulates the lining of the uterus to grow. And so what women do with their periods gives us a sense of where they are in what we call their phase of ovarian function, or where you are if you're in perimenopause or menopause. And so, anyways, estrogen goes everywhere. And as estrogen levels go up and down more dramatically in the midlife transition, like let's say if you're 45 and your ovaries start to sputter a bit, so you're not making as much estrogen as you used to, then maybe you get 3 nights of night sweats before your period starts. And hot flashes and night sweats happen more with low estrogen. So all these symptoms of midlife and menopause will happen as our estrogen levels fall. And one resource, like I really wanted women to understand all the symptoms of the midlife transition so they would know that they're not crazy, and they would have an easy way to communicate with their partners, their bosses, their friends. And so we call this tool the symptom circle. So if women go to our website, truewomenshealth.com, and just go to check my symptoms under resources, and the symptom circle actually spins when you click on it. So it's like an obstetrical dating wheel. So around the outside are the symptoms, and then there's cutouts of what you can do as a woman to make these symptoms better or worse. And so it's this fun circle that you can use to really understand, okay, these symptoms are real and what can I do about them? So, anyways, as we go through the midlife and menopause transition, our body is going through these changes. So, for example, I think about the perimenopause as the perfect storm. It's the time when, and as a pilot, right, you saw lots of perfect storms. But, a perfect storm is where one storm front's coming in. It's all the symptoms of menopause: hot flashes, night sweats, weight gain, sleep disturbance, cranky, anxiety, bladder urgency. So, because of all these symptoms, it changes the quality of our life. So, maybe if we're up with night sweats, we don't feel like getting up on the treadmill at 5 a.m. So there's all these symptoms that affect us. But then also what's happening because of changing hormone levels is that our physiology is changing, our inside is changing. So our bone cells aren't building as good quality bone and not as much good quality bone. So our bones are getting weaker. As our estrogen levels fall, it affects our liver and it makes us more insulin resistant. So our body craves sugar. The insulin is changing our fat activity. So belly fat with low estrogen creates more CRP and IL-6, which are inflammatory factors, and they damage our blood vessel lining and they increase our risk of heart disease and stroke. So there's all these physiological internal changes that are happening that we don't see, obviously, and then the symptoms. So as this perfect storm comes together, women in that first 5 years of menopause is the time where most women gain 15 to 30 pounds in that 5 years. A lot of women, their risk factors equal that of a man 5 years after that last menstrual period. So there's a lot we know about that transition and that time that really affects our health. How's that for a
Jeez,
summary?
that's amazing. Yes. Um, if I can, I just had a question pop in my mind that I've heard through
Sure.
our social media channels and everything with Dr. Stockwell's. One myth, I don't know, well, it might be a myth. So I'm hoping perhaps you might be able to bust it for me. You mentioned bone density as being an
Hmm.
issue. And we heard a myth through one of our listeners and subscribers to social media that bone density pretty much before if you don't, let me rephrase, if you get the amount of calcium that you're going to get over your life, let's put it that way,
Hmm.
the amount of calcium that your body is going to absorb into your bones, if it doesn't get the right amount before age 30, no matter how much calcium you absorb past age 30, it's not going to help. Is that true?
So, so it's just a bit of a misstatement. So it's right and wrong. So basically, at 32, we reach our peak bone mass. So our peak bone mass. So our are as strong as they're going to get at 32. So again, before 32, it's so important to get our vitamin D, which allows us to absorb calcium. We've got lots of estrogen going, before 32 to promote the bone builder cells. So our bones are in constant transition of the bone builder cells and the bone breakdown cells. So the builders and the diggers. So our bones remodel constantly. And even after 32, our bones are remodeling constantly. And I want you to think about vitamin D is what we need to absorb the calcium. And most of us north of Atlanta don't get enough vitamin D after Labor Day, so it's important to
Right.
take it. And then calcium is, think about it, the bricks of the wall of the bone. It's what we need for the brick building. So the bone builder cells take calcium and they put it down. So our bone builder cells are still remodeling, still taking in calcium after 32, but we'll never have a higher peak, but we can maintain it, right? So let's say someone gets to 60% of potential at 32. Maybe they don't take their D, they don't exercise, they don't take their calcium. And so they only reach 60% of their potential. So over the course of the next bit, they could maintain at 60% until they're 52 and they go into menopause. And then at 52, they're going to lose about 2% of bone per year without estrogen replacement therapy, right? And they'll lose less fast if they take estrogen, but they'll still lose if they don't take vitamin D and calcium. So it's so important to make sure we're getting 3 to 4 servings of calcium in our diet. And I use a free app on the phone called Calcium Calculator. And you can look at your diet and see if you're getting enough calcium. We all need about 1,200 milligrams a day. And again, I get
Wow.
enough in my diet, so I don't take a supplement. But then I make sure I take my vitamin D because I live in Michigan, so I take 2,000 units a day of my D. And then the other thing is I work out probably an hour a day, and it's just about getting that, stress on our bones so they know they need us. So if people are really sedentary, I worry. So for example, up in space, astronauts lose crazy amount of bone, like 10%. I'm making up a number, I don't remember it, but without gravity, we lose so much bone. So it's so important that even if, let's say, someone isn't capable of going for a run, can they just do their 50 jumps? My patients always tease me. They're like, oh my God, if you tell me one more time to do my 50 jumps, but every day get up and just jump up and down 50 times. And for women who can't even do that, I have a patient with MS, and that doesn't work for her, obviously, when she has when she gets more acute symptoms. So at our physical therapy office, we have a shaker, so she can stand on the shaker, and it actually has been shown to maintain bone density. So when she's
Wow.
can't do her jumps or her walking, then we get her on the shaker. And so it's just being really attentive to those 3 things. So hopefully I didn't ramble
Right.
too much, but does that make sense?
No, it does. It absolutely does. Absolutely does. And that kind of segued into my next question. I was going to ask you about physical activity and how important that is to our bone structure. A lot of people think, okay, I'm going to go run 3 miles a day and that'll be good for my cardio and my muscles, but they don't think about bone. But it's very important, apparently, to stress those bones so that they know to grab more
It is.
calcium out of your system. It's very good to know.
It is, and
Very good
and
to know.
even I'm a swimmer, and so I know I read a study that showed that even the flip turns, and I do flip turns and push off the wall, that even that push off the wall can help increase bone density. So I don't have to
Wow.
swim and do my 50 jumps. So as long as we're
Right.
stressing our bones, yes. So that was good news. So I'm covered.
Yeah, absolutely. Because that again is somewhat of a misnomer too. Well, not quite a misnomer, but I've heard that if you have an injury, swimming is good, or if you're having knee or joint issues, swimming is good. But then at the
Mhm.
same time, it's concerning that you're not getting that stress. But even the flip turn, that's really good to know. It's good to know for our swimmers out there who are listening.
There you go.
Um, you mentioned earlier too about bone density and how you lose 2% per year. And especially at that age of 52, it really starts to drop off without hormone therapy.
Hmm.
And there's a
Right.
lot of chatter out there about hormone therapy. There's some good chatter, there's some bad chatter in that hormone therapy is good for you. And then the bad chatter is no, absolutely not. Hormone therapy is not good for you. And here's
Hmm.
why. I know before
Sure.
we started recording, we chatted a little bit about that, and that's one thing that we
Informed
lay
consent.
people don't hear much about in normal conversation. Can you talk to us about hormone therapy, the pros, the cons, and just in general what it's about? Can you educate us about that a little bit?
I can, and again, we could talk about hours, talk hours about this, but I think the first concept is something about informed consent. So, I'm a surgeon, and whenever I would talk to a patient about considering a surgery, I would say, if you have cancer, I will get real bossy. You've got to have surgery, and this is how we're going to keep you safe. These are the pros and cons. But it really, the pros outweigh the cons for you. If you have a condition, let's say heavy bleeding, and fibroids that causes pain with intercourse or pressure on your bladder, then you have to be bossy with me as a surgeon and say, I really want my uterus out because it's affecting the quality of my life. But then it's our job, again, to talk about the pros and cons because heaven forbid a patient would have a bladder injury or an infection and have to come back into the hospital. I told my patients, I want to be able to look at you in the eyeballs. And we both know we did the surgery for the right reason, and you're going to be okay. And yeah, this is a pain in the butt to have to be back in the hospital, but you're going to be okay. And in the end, it's worth it because, again, we did it for the right reasons. And so that's the same approach I take with hormone replacement therapy. Now, a couple just upfront. Number one, FDA approved medication is available that is bioidentical. So I prescribe bioidentical FDA approved hormones and I don't subscribe to compounded hormone replacement therapy. I think about this conversation almost like a line from the movie The American President. In the absence of truth, we listen to whoever's talking. And unfortunately, back in 2003, when the WHI came out, there was so much misinformation about hormone safety is that who did people listen to? Suzanne Summers, where's her medical degree? But yet,
Mhm.
to her credit, she entered in a void, right? So us in traditional medicine, we dropped the ball. We totally dropped the ball. People got afraid about lawsuits or legal aspects of hormone replacement, and they just said, "Fine, we're not going to do it." We dropped the ball, and so now we really understand so much about hormone replacement therapy, and we have to make up for all that lost time of when people were talking about compounded hormones and all this. So again, we now have so many good products that are FDA approved, bioidentical hormones. We have oral, we have patch. And so, as we talk about hormone safety, hormones are way safer than most people think. Um, again, I'm an MD, I'm a menopause, I'm a certified menopause practitioner with the North American Menopause Society. And I'm going to take hormones till I die.
Okay.
And they're safe for me. I've made that decision. But again, it's looking at the pros and cons.
You threw out some really technical terms out there, and I just want to make sure our listeners, as well as myself, understand. You mentioned bioidentical hormones, and then I believe you said compounded hormones.
So in that void of time, for example, when the WHI came out, the WHI was a big study done in 2003 to look at the safety of hormone. Actually, the study was designed to look at do hormones reduce the risk of heart attack, and in that study, they they came out with the information about it, looking at the safety of hormones as well. And again, because of all this misinformation that came out with the study, and the study was done on Premarin, which is derived from horse urine. It's an estrogen of many different types. It is effective for hot flashes, but it's not bioidentical to humans. It's bioidentical to horses. But at the time,
Right,
that's all
in
that
their
was
urine. That
available.
just is a oh my goodness, that just is a turn off right there. They're
I know, I know.
derivative of
It's
their urine.
purified. The horses are well cared of, but it's bioidentical to horses, right? And so
Right.
the other thing is that the progesterone studied at the time was a synthetic progesterone. And so when that study came out, it's essentially looking at hormones that are not bioidentical to humans. And so now we know more and more about the safety of hormones. They're safer when they're bioidentical, meaning identical to the hormone that our ovary used to make. So in menopause, the ovary goes into retirement. It's done. It's not making any more estrogen, progesterone, and over time it makes no more testosterone. And so when we give a hormone back, we found that the safest way to do that is to give a hormone that's bioidentical or bioequivalent to the hormones that our ovary used to make. So, for example, like many women out there, I have thyroid disease. I have Hashimoto's. My thyroid doesn't make anymore. So, I take thyroid hormone every day. And I take thyroid hormone that's bioidentical to the thyroid hormone that my thyroid used to make, right? So, when
Yeah.
our ovary doesn't work anymore, then if we're going to choose to take hormone replacement therapy, we recommend that the safest way is to take hormones that are identical to what your ovary used to make. Now, again, back in the day before we caught up, compounding pharmacies were making it from, I don't really understand the process, but they were making hormones without the quality and safety checks of the FDA. So the FDA has very rigid quality checkpoints for four hormones in terms of safety, quality, and consistency. So from batch to batch. And what we know, there was a great article in the More magazine in 2014, and the magazine is no longer in business, but the article still it's out there. And what they did is they surveyed products from compounding pharmacies from all over the country, used an independent lab to analyze. And what they found is that from batch to batch, the hormones had between 0 and 1,000% of what it said was in there. And we know that in the FDA approved products, the patches, the pills, they're consistent every pill. And hormones are a powerful thing. So if you get a pill that one day works and the next pill out of the bottle doesn't, that's not good. We don't think that's safe. And so again, does that make sense and
It
explain?
does.
So that's why I prescribe FDA approved, and many insurances will cover it. Compounded hormones are not covered by insurance because they're not FDA approved.
Right, which makes perfect sense. And kind of my burning question though is how, if you know in the lab, like how do they make a bioidentical hormone? Like what's the derivative? What are the ingredients? How does it come to be?
Sure, they start with plant-based phytoestrogens, and they're able to change them to be bioidentical. And again,
Wow.
I'd much rather have. So there's several different companies that make different. So not necessarily supporting these companies, but the products that I prescribe are from companies with very well researched, very well studied products. And so, for example, Therapeutics MD, or there's Bear Pharmaceuticals, or there's lots of pharmaceutical companies that make these good FDA approved products, and they have, again, lots of peer-reviewed publications, meaning a lot of scientists have looked at the publications. There's great studies to show good effect and good safety and steady state blood levels. So we've really spent a lot of time and energy making sure that the products that we're able to offer our patients are safe and are consistent.
Sure, absolutely. Wow, that's fascinating. It comes from plants. Amazing. Amazing.
Hmm. Yes.
Huh. Very cool. Very cool. Well, thank you for that explanation. So, just to kind of recap, bioidentical, obviously the way to go, and also FDA approved, whereas the compounding pharmacies that were creating their own, if you will, definitely not a way to go. Do you know if in your community, not, obviously, I wish all women could come to you in Grand Rapids to get their treatment, but they may not. Um, is it pretty mainstream in the OBGYN and the menopausal field to prescribe the bioidentical hormones? Is that common practice? Except, in fact,
Well,
only practice, or are there still people out there prescribing these compounded hormones?
there are, and part of it is that, again, the menopause knowledge is fairly specialized in the sense of, even when I was a general OBGYN, I was so busy delivering babies and dealing with urgent everyday issues that until I took the time, I didn't have the training to understand this. And a lot of times in a busy practice, an OBGYN, like I did before I knew better, patients would come in and say, "Would you renew my script at a compounding pharmacy?" And I'd say, "Yeah, sure, here." Like, "Oh, they check
Right.
your levels, great, whatever." But now that I know the difference, like, no, we don't want to do that. And so, a lot of OBGYNs, it's not that they don't want to know the right thing to do, but they don't have the time or the bandwidth to spend time on this. And so one way for people to find a practitioner in their area is to go to the website menopause.org of the North American Menopause Society, and they can find a certified menopause practitioner in their area. So my most recent practice before I left, and I'm starting my own, I mandated that anybody who worked in our menopause practice had to be a certified menopause practitioner. So this really makes sure that this practitioner has this knowledge. They've gone to the meetings. The test actually to become a certified practitioner is not that easy, and so it really does give people assurance that they know what they're doing.
Wow, that's great. Awesome. Awesome. Menopause.org, and the proper terminology is a certified menopause practitioner. Did I get that
Yes, and
correct?
I'm very proud that I was the practitioner of the year for North America in 2015, which really gave me
That's
the.
huge.
Well, thank you. But it really just it told me I was on the right track, that I
Yes.
was getting the respect of my peers in the menopause world because of my research, because of the book that I wrote, really empowering women with the why of these, things that happen, and then moving into what women can do.
Right. Absolutely. Absolutely. Great segue, because my next question was, tell us a little bit about your book.
So, so the aha moment for all of this, I never thought about writing a book, or it was never my goal to write a book. But what happened is I remember sitting at the end of one of the menopause meetings and all these incredible researchers talking about new therapies for menopause, or talking about, heart disease after menopause, and what we can do to prevent, and what we can do to educate, patients. So all these amazing lectures. So after sitting there after 4 days of these lectures, thinking, okay, I'm going to go back to work in 2 days. I have young children. I have a busy practice. Like, how am I going to incorporate all this really good information into my everyday practice? Because women deserve to know this. It can't just sit in my head. I need, how can I get this information out to women? So, what I did is I actually wrote a clinical process of care we call waypoints. And so, what waypoints is it's a way to assess a woman's wellness, and then to talk about how we can use her goals to harness toward healthy aging. And so, in putting together this process of care, I then did a pilot study of 100 women. So we walked 100 women through this process in terms of assessing their wellness in 9 areas, and then looking at their goals and creating actually what's called a life map. So we put their goals on a life map, where they are on the life map, and then looked at their barriers and made a plan. And these 100 women did so well. They came back for 5 visits over 6 months, paying their insurance copays every time. It had an 85% retention rate. People stayed in the program. And women lost on average 2.5 inches of waist circumference. So we got rid of that, you know, terrible belly fat that causes heart attacks. So women got rid of belly fat, and they were happier and healthier, and their menopause symptoms went away, whether or not they did hormones or medication or just really adjusted their lifestyle. And so the book
Wow.
that I wrote is called I Want to Age Like That: Healthy Aging Through Midlife and Menopause. And I named it that because we all have a that. My goals, or what drives me, is different than what drives you or drives somebody else. And so, as we all figure out what our that is, then it's how we can get there. And so, my book is the stories of the women who went through the pilot study. And so,
Oh,
we
wow.
interviewed the women after the fact. My editor interviewed the women, so it wasn't just me. And so we really understood their stories of why they started the program and what they learned through the program. And it basically goes through. And the third edition of the book is coming out, including a workbook. And so women can go to truewomenshealth.com or Amazon if they're interested. But basically, it just really lines out this program, and it's just been so powerful. And at True Women's Health, we will be following that program of waypoints in our clinic, and also as we develop, online. So it's so fun to be able to put all this information that's out there about wellness, about healthy aging, about the power of hormones, and put it into a program that women can use. And that's just, again, to create this has been so satisfying.
Right. Oh, that's amazing. That's amazing. So, not only do you have 25 years of experience, you've written a book, you've done research, it's research backed. It's a research backed book, but yet it's the fun, it sounds like it has a really fun storyline, taking all of the if you will, the academic jargon out of all your efforts researching and putting it into a story format, which sounds amazing.
Well, and it's so
And
fun. And the highest compliment I had about the book was a friend read it who knows my voice and knows how I talk. But she said I could just hear you in the stories. But also, she said I felt like I was sitting next to you with a glass of wine, and you were telling me these stories, but yet you're a doctor, and you're
oh,
offering the why and offering solutions, but yet you're a doctor. But yet I felt like I was talking to my best friend. And that's what, again, has been so rewarding, to get this information in the hands of women, but then offer a way, what do you do with this information? And I think that's the
right.
crux.
Right. Absolutely, absolutely. That is amazing. So with True Dot Women's Health, not only you guys have a brick and mortar where women can come in and start that practice with you, and go in and not so much the practice, but start that
Sure.
routine of checkups with you. But you guys are also, it sounds like, pivoting to an online platform as well. Did I hear you correctly with that?
Yes. So, when our clinic opens, we'll actually have an app. We're working with an incredible digital therapeutics company called Remedy, and we're developing an app that will allow women to track their symptoms, their habits, and see how the two relate. So, for example, if you didn't drink your water and you gained 5 pounds and you had 2 glasses of wine, yeah, guess what? You're going to have night sweats. So, it allows you to track those things so you can see how your habits affect your symptoms. And that will be a really cool addition for our clinic. And as our patients use it, potentially then if people are wanting it, we could offer it on a wider scale. But I really look forward to again providing women the tools to use so the knowledge is in their hands and then they can do with it as they want. I'm a bossy Dutch girl. I don't want to be told what to do, right? No, who wants to be told what to do? No one. So it's
Right.
basically you
Right.
give me that information and I'll figure out how this works in my life. I don't want you to tell me what to do. And that makes me remember one of my original aha moments with just being a physician and what that means and the role we play in our lives. I was so fortunate to spend a week with Dr. T. Barry Brazelton. For the parents out there to read his book Touch Points is just life changing. But I got to spend a week
Yes.
with him, and he told me, Diana, don't ever, 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 ever tell a patient what to do. That is not our job. Our job is to provide anticipatory guidance. We talk about what's going to happen, and then when it happens, patients are like, oh, they do know what they're talking about. And then now we have a trusted partner. We're here to understand what they're going through, but then to be able to predict. So I love that concept of anticipatory guidance. So, for example, to be able to tell you at 38, this is what's going to happen as you age. This is what's going to happen as your estrogen levels change, in terms of, let's say, loss of muscle mass and loss of bone mass. So this is what's going to happen. This is how you're going to feel. And as that starts to happen, you're like, oh, okay, I do have a partner in my care. And then for me to say, here are your options. I would tell my patients all the time, I have zero ego invested in what you do. It's none of my business. I'm not your mom. I'm not your boss. I'm not your partner. You know, it's your business, but I have so much ego invested in you knowing why these symptoms are happening and you knowing what you can do about it. I have so much ego invested in that because you deserve to know as much as I do, as much as my sister does, as much as my best friend does. And so here it is. Here's the why. Here's whatever. And no matter what you choose, I'm going to support you. So yeah, if you choose to smoke and then you choose to gain weight and you have issues, I'm here for you. No judgment. I have patients who are very ashamed, for example, that they still smoke 4 cigarettes a day. And I'll say, as your doctor, I wish you didn't because it's a choice that's not in your best interest. But I'm not your boss, and shame doesn't help. And let's talk about this. Talk to me about how you want to be. Do you want to be able to hike up a mountain with your kids on spring break? Well, yeah. Are those cigarettes helping you do what you want? Oh, I didn't think of it that way. So it's basically supporting people in their journey without judgment or shame and offering
Awesome.
options.
Awesome. No, that sounds absolutely perfect. You're right. I mean, no, not only do bossy Dutch girls not like to be told what to do, but bossy pilots and mothers and wives and pretty much every woman out there does not like to be told what to
Exactly.
do. And
Yeah,
providing that, not only are you a medical expert, but you're that friendly, non-judgmental ear, which I think is so crucial,
right.
especially for we ladies, at that tender point in life, approaching menopause and within
Yeah.
menopause.
Well,
It's a
I
long,
laugh too. You
long
say
journey.
bossy pilot, and I'm a bossy surgeon, but as a pilot, right, you follow your checklist beforehand and you introduce
Absolutely.
yourself to your co-pilot who you probably have flown with for 10 years, but you create that sense of team. In the OR, we would do the same thing. So for bossy
Yep.
surgeons to be told, okay, slow down, you got to do your checklist, but it's all in the safety of all of us. And so the more information we have, it's a complex world. Aging is a complex process, just like flying a plane, like doing a hysterectomy. Like there's a lot of complexity. And so, again, that's why I wrote waypoints. It's a checklist. It's a checklist for us to go through and see, how healthy am I? What's my heart health like? What do I have in my health bank is like how I like to think about it.
Sure. Absolutely. Absolutely. Well, Dr. Bittner, it has been an absolute honor. And before I let you go, I'm going to give you the last word. What kind of advice would you give your a daughter, a close friend, a mother, your mother, your close friend, your daughter, your sister? What would be your A plus number one bit of advice to give them that you can share with our listeners?
Hmm. I mean, when I say to patients, I want to know you. I want to know what makes you tick. I want to know, um, what are your goals and where have you been and where do you want to be? What's hard for you. But more than anything, I want you to know you. And so I would just challenge women to really know themselves, and not put their head in the sand in terms of aging. Like, really know, what are my risks for breast cancer? What are my risks for heart attack? Um, and to really be very self-aware about all those things, so you don't wake up at 60 with an illness that you could have prevented. I think it's to think about it like a financial plan. You might think, oh, I want to retire with $1 million. Well, and so you meet with a financial planner, and you think about, okay, what have I saved? What are my spending habits? What am I going to end up with at 60? We all get that, right? But how many of us have really made a health goal and been intentional about that? And then how many of us have a plan to get there? So again, I would challenge everyone, no matter your age or your health status, whether you're affected by cancer and you're starting your new normal, or wherever you are in that process, to have a very clear goal. We call that in waypoints, we call that your picture of self. How do you picture yourself at a milestone event, a retirement, a wedding, a birthday? So to really have a clear picture of self, and then to have a plan to get there, and to find a partner in your healthcare that can help you get there. That's what I would say.
That is amazing advice. Absolutely amazing advice. Thank you so much. And ladies and gentlemen, thank you for tuning in. Again, we are here with Dr. Dianna Bitner from Grand Rapids, Michigan, the Chief Medical Officer and founder of True Women's Health. She's opening her practice, brick and mortar practice in Grand Rapids on May 4th. And in the meantime, she is also has a online platform, truewomenshealth.com.
And we're very active on our social media. Our Facebook page is fun. In fact, I'm doing a Facebook Live event tonight with a local I Move Physical Therapy on sexual health and helping women reclaim their sexual health. So all of those events will be archived, and it's just so fun with what social media is doing these days to promote, and we can just promote wellness and good health.
Absolutely, absolutely. So your Facebook page, are you guys up on Instagram and Twitter as well?
We are on Instagram, we're on Twitter, and we're thinking about how we can get on TikTok. So my
Excellent, excellent.
my daughter is a marketing major at Michigan State, so she's helping guide the social
Oh,
media.
perfect.
Making
Perfect, perfect.
so it's
So
good.
awesome. So for our listeners, if they did want to get on that fun Facebook Live event tonight, what is your Facebook page? Is it True Women's Health or is it specific to your name?
Yep, it's True Women's Health. And
True Women's
again,
Health.
True Women's Health. So all our events are archived, and yet, so we're having so much fun with this. Again, just promoting all aspect of women's health, including sexual health, and how that affects all of us.
Perfect. That sounds amazing. So Facebook, Instagram, Twitter, and we'll look for you on TikTok as well. True Women's Health. Excellent.
With the
Thank you
times.
again, Dr. Bittner. It's been an
Thank you,
absolute
Diana.
pleasure and have a wonderful rest of your day.
Thank you, you too.